My hip hurts, my knee hurts, my x-ray shows bone-on-bone arthritis. But when do I know it's time to get my hip or knee replacement? I keep getting asked this question by dozens of patients in my clinic on a regular basis. Hello, I'm Professor Manish Kiran. I'm a consultant orthopedic surgeon with a specialist interest in your bone and joint health. Well, here are some pointers that might help you decide the timing of your operation. The most important aspect to consider is pain. Is your pain present all the time? Does your pain stop you from doing your activities of daily living, like going up and down stairs or getting up from a chair? Does your pain stop you from going to sleep? Does your pain wake you up on a regular basis? It's probably a good time to consider surgery if all these aspects are present. The next thing to consider is, have you used up all the non-surgical management options, which would include activity modification, medications for pain, weight management, physiotherapy? If you have indeed, and you continue to have pain, then it would be a time to consider a joint replacement. The third aspect that you need to consider is your life shrinking? Are you stopping to go for a walk with your family? Have you declined those dinner parties that you so much enjoyed? Has your number of rounds of golf shrunk from 18 to probably 1 or 2 holes? Is your pain taking over your life? If it is, then yes, it's time to get your joint replacement. I hope this helps. If you are at the stage that you think the pain is bad enough, please do get in touch with your specialist and they can take you through your surgical options. If you found this content helpful, please do like, share and subscribe so that other patients who are trying to find answers to their questions find this video. Thank you.